and identifying potential new areas for future collaborations. So as you might know, these webinars are being recorded for those who cannot make it. You can get a recording afterwards, either on YouTube or for those working at ITM on our internal Dropbox page. And in terms of practicalities, Nilsa will be presenting for about 40 minutes about INS in general, about what we do together as INS and ITM, and about future areas for potential collaborations. And then afterwards, you're free to ask questions. You can do so in the Q&A section, or since we're not too many, you could also do so in the chat. You can either just type your question, or otherwise you raise your hand afterwards, and I'll allow you to unmute, and then you can ask your question live to Nilsa. So ITM and INS, we've been working together already for almost 10 years on a project called BigMins, Building Institutional Capacity at INS. It is a program which is financed by the Flemish Government, but we have also been working together on a number of other initiatives. Doutora Nilsa Judeus, she is already with INS since 2011, where she worked for 4 years as the head of the research department. And she's already for 10 years been coordinating this BigMins collaboration with ITM. So I'll give the word now to Nilsa, who will also share a presentation with you. Nilsa, please.
Thank you, Eileen. Thank you for the invitation. Let me just upload my presentation, and I'll be ready. Okay. So, can you see my presentation? Okay. Thank you very much. So this is a great pleasure to do this presentation. Hope that my internet is stable until the end of the presentation. I'm going to introduce the National Institute of Health from Mozambique. In Portuguese, we say Instituto Nacional de Saúde. Sorry, I'll be talking about INS many times. First, to get to know a little bit of me, as you already said, I was trained as vet at Eduardo Mondlane University in Mozambique, and then I did a post-graduation, the master and PhD at Autonomous University in Barcelona. I worked at Manisa Health Research Center. I worked on HIV in exposed non-infected children. Then I moved in 2011 to the National Institute of Health, where I worked as head of research department. On that time, I got to know the BigMins project that you mentioned. And at the moment, I'm working as researcher on the enteric infections, on vaccine impact and immunogenicity. I also work as the president of Institutional Ethics Committee, and I'm coordinating the BigMins project. At the same time, I'm working at Eduardo Mondlane University and Superior Institute of Science and Technology as professor. So this is a brief history about INS. So the first time INS was created in 1955, based on the Institute of Medical Research of Mozambique. Let me put the pointer here. Has Medical Research of Mozambique, and its conversion in the Provincial Institute of Public Health was happened in the 70s. Then in the year of the independence of Mozambique, INS was incorporated into the Ministry of Health. Here we called MISAO. in the National Directorate of Preventive Medicine immediately after the independence of the country. In 19th, INS was established as a semi-autonomous institute by ministerial diploma. And then in 2004, an organic statute of INS was approved and have been punctually revised in 2010. In 2017, INS was redefined as a tutored institution with a new organic statute published in 2018 and the internal regulation in 2019. So you can see here the document about this redefinition of the institution. These pictures show the inauguration of the headquarters INS. Before we were working in the building of the Ministry of Health. And then after we built this building, sorry for this repetition, we have moved to the headquarters located 30 kilometers from the capital of Mozambique, Maputo city. So we are located now in Marapuene. This is the main entrance of the building. And here down is the lateral view of the building. In this picture is our director, Dr. Ilesh Jani, with the president of Mozambique, Felipe Nyusi, explaining, our colleague Adolfo is explaining how things work in the laboratory. This was very important for us as an institution to have this new building. So the redefinition of the INS used the contemporary practice of a public health. As a national public health institute, the INS is a science-based organization that provides leadership and expertise at the national level to achieve long-term improvements in the public health. The National Public Health Institute are normally multifaceted organizations that include staff with different and a wide range of skills, experience, capable of performing critical functions such as health surveillance and also research. Because because they are scientifically based, the National Public Health Institute are more reliable source of policy advice normally for the countries. So based on that, the INS attributions based on the decree 57 from 2017 elaborated the policies proposal. Sorry, I'm trying to take out this, I want to take out this, okay, because this, yes, now it's better, thank you. Elaboration of policy proposals, for example, and evaluations of strategies in the area of health research at the local level, and also ensure that they are correctly implemented, monitoring, inspected, and periodically evaluated. Also, INS attribution is on promoting the development of research in health to the different level of attention, from the basic level until high level, to guarantee a better definition of the health policy and program management, with the aim to responding in the timely manner and effective to health problems. Additionally, INS also has an attribution to conduct clinical, biomedical, pharmacological, epidemiological, and operational socio-anthropological and health system based on the priority. This research also should be based on health priority. INS also has the attribution to contribute to development, evaluation, and promoting of the use of appropriate health technologies. Also, INS has the mandate to contribute to the prevention and control of endemics and epidemics in the country, and management of specific public health events, to contribute to the development of human resources, particularly in the technical, professional, and scientific areas, specifically from health, to take care of quality control of the laboratory analysis through the laboratory reference systems, to disseminate the scientific information to the community, not only to the scientific community, but also to health workers and the general public, to conduct health observation, to document the health status of the population and its determinants, and to establish partnership with other national and international institutes to carry out research, training, and public health activities. This is the structure from the INS. We have in the top the general director, who is the general manager from the institution. We have a deputy director, and they work together. And then we have two independent committees, namely the ethics committees, the ethics committee and biosafety or biosecurity committee. Then we have four directorates. We have the directorates of research in health and welfare, the directorate of inquiries and health observation, the directorates of health laboratories, and directorates of training and communication in health. Those four directorates work with all INS structure. And then we have three, independent departments: the quality department, the financing and administration department, and human resources. And then we have the repartition procurement. Apart from that, INS has now, we call it health delegates or delegations. At the moment, we have Maputo delegation, Sofala, and Nampula delegation. The INS has two provincial delegation operating and is in presence in 8 provinces. For example, in Maputo province, we have the headquarters that I showed the pictures. We have the TB research unit in Machava. In Maputo City, we have the delegation of INS in Maputo, which includes Pulana Kanisu Health Research Center, which is specialized on conducting clinical research studies. Also train the people on good clinical laboratory practice and ethical. And we also have in Maputo a unity called Biomedical Research Unit at Mavalane General Hospital. Then in the center of the country, we have a Sofala delegation, which includes Beira Operational Research Center and a laboratory of TB, which tests the TB for the central region of the country, and one public health laboratory. In Nampula delegation, we also have a TB regional laboratory and a public health laboratory. In Gaza, we have a health research and training center located in Shokwe. In Nyambani, we have one public health laboratory, in Cabo Delgado also, and in Zambezia province, we have Kilimani Health Research and Training Center. So in operation, we have now the delegation of Cabo Delgado, Zambezia, and Tete, which are going to be formalized soon, so that the presence of INS in the provinces will be more wider. In this graphic, I show the number of INS employees in Maputo between 2010 and 2021. We are more than 500 professionals it's in 2021, from which 52% are females and 48% males. So if you have a look, the professionals from INS have been increasing along the year, and this increasing is due to the expansion of the institution and the growth of the institution. And additionally, we have more than 120 professionals outside of Maputo. This information is based on 2021, so it has to be updated. If we look from the professionals or employees by education level in 2021, we see that the majority of the professional from INS are graduated. So we have graduated, and then we have a big challenge as a scientific institution. We only had in 2021 25 PhD employees, but an increasing number of masters, almost 17. That's why INS has been doing a lot of effort to train the personnel so that can implement the activities with excellence if we have more trained personnel in the institution. So the INS strategy, which is mainly interesting or should be interesting also for ITM people, we have 8 scientific programs. This is the cover of our strategy until 2025. And here down, we have the first national research agenda from the country. Now we have been revising for the coming 5 years. Going back to the 8 scientific programs, we have the health and environment, including occupational health, mental health, trauma and violence, women and children health, adolescent, elderly, and other vulnerable population, determinants of chronic diseases, vector transmitted, neglected, and zoonotic diseases, endemic diseases of great impact and health system. If you ask me, from all these 8 areas, which one is the most, let's say, busy in the institution, I would say the 7, the endemic diseases of great health impact, because it includes HIV, TB, enteric infection, malaria. This is the big one. I'm going to show some of the examples of the activities that the institution is implementing. Last year, we had 70 research projects started, including 26 on COVID-19, 82 published articles in international scientific journals between 2020 and 2021. We have implemented a survey on cholera vaccine for cholera control and prevention in Nampula, Tete, Kwamba, because we registered some cholera cases in those sites in these provinces, and these 2 provinces, Nampula, Tete, and Kwamba in Niassa province. We did research on HIV, COVID-19, and polio vaccines We have ongoing studies on this area. We have also clinical studies on diagnostics and treatment of HIV in newborns in Sofala province, Manica, and also in Tanzania. This is a multicentric study where INS also is part. An assessment of public health challenges in the communities of small scale artisanal gold mining, because this activity is very prolific in our country. For the reference laboratory services, we have several provincial public health laboratories established, and with the COVID, we also we increased the number of provincial public health laboratories. We have in Cabo Delgado, Nampula, Sofala, and Inhambane, and currently in progress in Niassa, Tete, and Manica. Niassa is in the north of the country, Tete and Manica are in the center. We had, as an example, almost 500,000 specialized tests performed by ANS in 2021, from which we had a lot of them, 7%, almost 80%, I should say, from COVID, from SARS-CoV-2, because INS was and is the main reference laboratory for testing SARS-CoV-2 in the country. We have a menu of 47 specialized tests and 24 accredited on ISO 15000. So this shows that the institution is working to accredited more testers in the institution. We have also almost 1,000 testing sites in all provinces benefited from external quality program in 2021, 37 laboratories in comprehensive program to support the implementation of quality management. We have a big program which is called Fogella in the country, and this is a program to accredit the laboratory to implement a quality of the laboratories in the country, on all over the country, not only from the laboratories from INS, but also from other institutions, for example, from the hospitals. And then we have also, in Portuguese, we call the Fogelinha. It's like a small Fogella project in the provinces where we are doing also the quality management. We have also implemented SARS-CoV-2 genomic surveillance, also to monitor the types of SARS-CoV-2 in circulation in the country. And we issue a bulletin or like a small result from the SARS-CoV-2 genomic surveillance to show the population which kind of strains are circulating every month in the country. Regarding communication and health information, we held the scientific conference for COVID-19 in Mozambique in 2020 and 2021. INS is also responsible to organize the National Health Conference every 3 years in the country. For example, in 2018, we organized it in Maputo with more than 1,000 delegates from all the provinces and 500 scientific communication. And in 2021, also we did this conference in Maputo with 500 scientific communication and 4,000, more than almost 5,000 delegation and 5 virtual rooms. We had streaming on Facebook, so it allows that more than 18 participants could attend the conference. We also organized a regional health conference in the north of the country in 2019 in Nampula with 200 delegations and more than 100 scientific communication. Normally what we do is to do the national conference in Maputo and then regional conference in the center, in the north, and then the third year is come back again to the national conference in Maputo. So this year we are going to do in Tete now on 27 and 28 of October, we are going to do the conference in the center of the country. INS has also publication of the Mozambican Journal of Health Science. We publish in a special issue on COVID-19 in 2020. This is the cover of our journal. Regarding specialized training, we have trained journalists on communication on COVID in 2020 and 2021. INS also organized graduated health courses on master, PhD, and medical specialty in public health. In our institution, we normally receive about 85 graduate students that we call them residents, and they were graduated in 2021. We also do short courses in different areas on biosafety, quality management, laboratory techniques, investigation methodology, health surveillance, and communication, with almost 2,000 participants trained in 2021. We also had more than 100 interns undergraduate course in 2021. Here are some of the pictures from the training that we held at INS. You can see there in the back the director from INS, Dr. Ilash Jani, and the directorate from research, Dr. Sergio Shikumbi. And here in right side, you can see also the graduates with the certificates from a training done by INS. Regarding the National Health Observatory, some of the examples, this was established in 2016-17. This is a platform which is managed multi-sectorial with a secretariat at INS. The secretariat formally included in the organic structure of INS in 2019. And this platform analyzes the available data to inform discussions on health policy practices and policies, with a focus on health determinants, health systems, and inequity. It works by observation groups or platforms. For example, we have a platform for women and child health, HIV, health system, climate and health, and also on health intervention. On health surveillance and the national surveys, we have implemented surveillance against several health conditions. For example, on SARS-CoV-2, implementation on SARS-CoV-2 sero-epidemiological survey, we did a national survey. The report is available if one of you want to see it. We also did a health surveillance in the context of Idai and Kennedy, which is a climate problem that we had in Mozambique. We have a national diarrhea surveillance implemented, national surveillance on measles and rubella, tuberculosis drug resistance surveillance, national meningitis surveillance also are working. Also, we have the community surveillance on mortality and vital events that we call it COMSA. Corolla vaccine coverage surveys that we have implemented in Nampula, as I previously shared with you. We have national tuberculosis prevalence surveillance that we did in 2019. The national survey of immunization, malaria, and HIV indicators, we called it IMACIDA. Every 5 years, we do this survey, to determine the prevalence of HIV in the country. Also, on malaria indicators survey, on health service availability and readiness in the country, on vaccine coverage after the introduction of vaccine against rubella. It was done in 2018. Now I'm going to talk a little bit about the Big Means project that we have in collaboration with ITM. I decided to put this after have contextualized about INS to increase the understanding of the project in its essence. So the main objective of this project is to strengthen the capacity of INS with emphasis on promoting an environment for conducting research in Mozambique and embedding research findings and surveillance in the Mozambican health system. Specifically, this project has the objective to lead and encourage the implementation of high-quality health research in Mozambique and to ensure the communication of evidence generated to stakeholders and the general public to improve health practice and well-being in the country. For the phase 3, this Big Means project, I will come back again in the next slide about the funding of the project. For the phase 3 that we are now, as the project since the beginning has the main objective to strengthen the capacity of INS. In the phase 3, it continued to strengthen the capacity of INS, but with the focus even more to full incorporation of research and surveillance in the Mozambican health system. And we designed the project to achieve 3 main results. The first one is to have a strong INS that leads by example in generating evidence for health practice in Mozambique. The second one is to enabling environment that supports the scientific communication community across the country to grow and produce quality research that can contribute to the health of the population, because the majority of the research that is done in the country are led by 3 main institutions from INS, Manisa Health Research Center, and the Faculty of Medicine from Eduardo Mondlane University. So there is a need to increase the research and the evidence-based in the country. To develop an effective communication between health researchers and key stakeholders too. So the Big Means project is being implemented funded by Flanders government. For the phase 3, the duration is 5 years. We are going to finish now, but likely we are going to ask for a no-cost extension, and is characterized as institutional strengthening project. I bring here, since the beginning of the project in June 2012, the main results. If you have a see here, in fact, the results here below are from phase 1 and 2. I combined the both of them. So what we have achieved in the Big Means project in the phase 1 and phase 2. For example, we have a strengthening the ethics and scientific committee in the institution, because INS, when we started, did not have the ethics committee, but that time was established, was trained, and was implemented, and also the scientific committee. The project also allowed INS to do an auditing, a general auditing, because before the auditing in the institution was done vertically by projects. But with the Big Means project, we have started to do a general auditing at INS. And we also created a culture to produce reports. We have produced triannual reports. We continued that. For example, now we are finalizing the reports from 2021, 22, and 19. So we are going to launch a triannual report also. We have given grants to employees at INS to increase the productivity from our employees, but also to stimulate them. We have trained through the Big Means project 23 masters in health science in collaboration with Fiocruz from Brazil, because Mozambique has limited number of master's program. And then we had 2 employees from INS trained by at ITM, and the third one did not finish yet, continued during the phase 3. We have implemented several short courses. We have developed the first national research agenda that I showed you previously when I presented scientific strategy from the institution. So this national research agenda was funded by Big Means. We have funded also 29 INS projects, internal projects aligned with the priority from the institution and from the country. And we also did several meetings with policy makers to discuss, to present and discuss the results of research. So for the phase 3, we have implemented a surveillance on antimicrobial resistance in Maputo city so that we can collect evidence on the resistance to share with the Ministry of Health and create an awareness about this problematic in the country. We have 2 master trained at ITM, which is both of them are going to work on health policy communication office to translate the evidence into policies. We also attributed scholarship on PhD students from INS in different institutions, because in Mozambique, we only have 1 PhD program on science. So our employees at INS are working are doing the PhD in Portugal, Germany, Brazil, even in United States. We have funded research extramural from the provinces. Normally, the funding for extramural research in Mozambique, it's not enough to cover all the provinces. We are developing national guidelines on health research. We did several short courses on ethics, scientific methodology, and writing, and we are implementing a health policy communication office at INS. So for me, I would like to thank you for the attention. This is a beautiful island that we have in the north of the country, in Ilha de Mozambique. So Mozambique Island is a beautiful island I've visited last week, and I was fascinated about this, and I understand why it was the first capital of the country, and then it moved it to Maputo. I encourage you to visit these islands. Thank you very much.
Thank you so much, Nilsa, for the very interesting presentation. I was lucky enough already to visit Ilha de Mozambique. I can just encourage all the others to do the same.
You already visited?
I already did.
Oh,
okay.
Did you like it?
A lot. So I'll now open the floor to questions for anybody who has anything they want to ask Nilsa about the work of INS, about potential future areas for collaboration, about the projects we have been doing together so far. Willem, would you like to ask your question out loud, or shall I just read it? Where do I find you in the list?
Yes,
okay.
I found the unmute. Yes, thank you very much for this very nice presentation. I just wanted to ask, I'm on my way to Tete province, and I would like to ask, is there not also an INS provincial delegation in Tete?
Can I answer?
Please.
Okay, so INS is about to create the delegation of INS in Tete. It's not formalized yet, but if you need help to contact someone in Tete and get help from INS, I will be happy to help you on that.
Great, thank you so much.
Welcome.
All right, Sander, I see you also have a question. You should be, wait, where did I put you? You disappeared. You should be able to unmute now.
Yes.
Yes.
Do you hear me?
Yes, loud and clear.
Okay. Thank you very much for this excellent presentation. It's always nice to see how INS is really growing up and has already reached quite a stage of maturity during the years. It's fantastic to see. But also, I wonder, we have seen that you did very original work during COVID-19. It's still ongoing work, very innovative work also with social media, etc., and locating people who might be more at risk of infections, etc. And I know that you were really well listened to by your government. So the government of Mozambique was really very receptive to those messages and to that policy advice done by or produced by INS. But I wonder, in more general terms, do you have the feeling that the actual Ministry of Health is also listening in other areas to INS policy advice? Because even here in Belgium, or maybe even more here in Belgium, it's very difficult to convince politicians through evidence sometimes. They really want to be informed, but it's really hard to make them sometimes act on evidence. Maybe you can share some experiences in that area.
Excuse me, Sander, if you could quickly introduce yourself as well, because not everybody here knows who you are.
Yeah, I'm Sander Sparrow. I'm a policy officer on development cooperation, and I'm working for the Flanders Department of Chancellery and Foreign Affairs. So we support also INS in its work.
Thank you.
Thank you, Sanders. It's nice to hear you. Quite long without speaking to you. It's nice. I think that now with the COVID, INS has gained more visibility. And even before INS, even before the COVID, INS was working with the Minister of Health. Of course, it's not easy to work with policymakers, not in Belgium, neither in Mozambique. So we have good experiences on health policies on HIV. For example, I'm going to use the point of care. We successfully advocated to use the point of care to test, for example, for children, because before the test was sending to Maputo, and then the results were returning very late to the provinces so that the children could start the antiviral treatment. So we could convince the policymakers to implement point of care, to test the children even earlier, and then to start treating. Also for test and treat, we are working strictly with them. Of course, there are areas that we would like to improve. For example, we have been working, if you can see the INS page today, we had a new where we have been discussing with the tuberculosis program to establish a priority. We have been sitting with the programs and ask them, what are your priorities and how can INS contribute for on the evidence produced so that those priorities can be met, and then to at the end result in change of policies. So it's a work in progress. That's why in phase 3 we have these 2 master students that they did the master at ITM. The objective is to implement the health policy to communication. So to have people dedicated to work with the policymakers to increase this collection of evidence and translation to the policymakers. So hope that I could help you on that, Sanders.
All right. Any other questions from other people? At the moment, I'm not seeing any. Yes, Elizabeth, I'll let you unmute. Let me see where you are. Can you please first introduce yourself briefly and then go ahead and ask your question.
Hello, everybody. I'm Elizabeth. Thank you for a wonderful presentation. Thank you for the opportunity, Helene. My question to the presenter is, what were your greatest hurdles in terms of policy change within Mozambique during COVID? And this is linked to organizational culture. So this is, my question basically, but thank you for a wonderful presentation.
Elizabeth, could you please just introduce yourself? Yes.
Apologies, I'm an ITM alumni. I did my MPH from there. I finished in 2021. So I am an alumni and I work with MSF in management. I'm an elected board member. So I deal a lot with governance issues. So from a global perspective. So this is why I'm curious about organizational culture and change management and the challenges in Mozambique during COVID.
Eileen, I'm not sure if I got the first part, sorry, because my internet oscillated.
So Elizabeth is asking about what the biggest hurdles were with regard to policy changes during COVID peaks, and especially also in relation to the organizational culture at INS. So within the Institute, how was this managed? Yes, how was policy change addressed, etc.
Okay. So for INS, it was challenging, but from the beginning, when we started, how do you say, reporting the first cases of COVID in the country, we received a message from our director saying that we have to stay at home. I think that we were one of the first institutions in the country where we had this advice from our directors to say, okay, if you have to start to do how do you say, shiftings, agenda, to say, okay, if in one department, for example, you are 10, 5 should this week would work at home and other 5 would go to INS. So this was a very important decision from the institution, mostly because the intention was to protect the specific population. And then for the elder people, we received the advertise that those people with more than 50 years, let's say, they had to stay at home because to avoid this exposition for the COVID. And then the president established that nobody should go outside and so on. But from our institution, we were already practicing this, and also to put the mask. The other thing that marked me, and I have reminded myself, is that the direction of INS asked the researchers to contribute with science and with evidence. So we have started to write a proposal to look for evidence on COVID. Another intervention from INS, which was very important, was about the gossips in the society or in the community, because when we started to inform the population about COVID, we have established it with the Minister of Health, an official communication to inform the COVID. People were started before to gossip about that. So when it was established, the gossip stopped in the country, because they were starting to spread information about COVID, but were not true about the information about mortality, about the number of people that were sick. But after that, all of us were very attentive to the television, because someone from the Ministry of Health was talking about the policies, and someone from INS, in that case, the director or the deputy director, was talking about the scientific issues of COVID, and also about the work that INS was doing to establish the routes of transmission of the virus in the country. So I think that was very important for our country to remain calm and to understand the importance of having, for example, the people at home. Because we were working with evidence to say, okay, we have this number of people tested, those ones are positive, from which provinces. So the people started to understand about the COVID and about also the use of the masks, the importance of that. Hope that I could answer to your question. Thank you.
Thank you so much. Yes, Elizabeth responded in the chat saying, thank you so much, and it's well understood. Okay. Any other questions still? Otherwise, we have a few minutes left, so I might myself ask a short question. Over the different phases of the Big Means project, we see actually, especially in terms of results and solid outputs, that it's been growing over different years. There will most likely be a phase 4 as well. What do you see as key priorities for INS in terms of needs for capacity strengthening or interest in working together with ITM? Would you already have a view on these things?
Yes, I have a personal opinion.
That's something else, but that's fine.
Yes, it's a personal opinion and does not reflect the opinion from the institution, of course. Having a look on the graphic that I show you about the number of employees and the education of the employees, it's notable that the number of people with PhD in the institution is growing. When I joined INS, I think that we were 5 with PhD. Now we are 25, okay? So this is very important. And the role of Big Means project and this funding that we have, the good thing is that this funding is not vertical. The majority of the fundings that INS has are to HIV or to TB or respiratory disease, which is very tied to some disease. But Big Means is good because it's wide, and because of that, the impact is more broader. And the greater impact of the Big Means project for me is the training of the people, because the most valuable resource in the institution or in the country is the people. If you have educated people, trained people, competent people, the institution can accomplish the mission. So through the Big Means project, we have been training people on masters. Most of those people that are trained in masters, they are doing now PhDs. And we also, through Big Means project, are funding that. And we are able to fund the PhD outside the country, because the country only has one PhD program, which is very challenging for a country which wants to grow, that doesn't have a PhD on health science. Myself, for example, in my projects, my collaborators normally get surprised when I say that in my country, we only have one PhD program. So it's good because it is allowing people to be trained and grow in the institution. Now we have a postdoc program. So I think that for the next phase, a good program would be to give like small grants to increase a little bit more the grants that we are giving to the postdoc in a competitive manner, so that they can get used to be competitive internally, to be also competitive outside. To establish, for example, a committee where can evaluate, an external committee or a mix of committee to evaluate the proposal, and then to fund the best proposal, to allow the research from INS to work in a small project, and also to have students, to have students that can impact, because there is no organization that can grow without leadership. So we have to create leaders in the institution that can have impact in the institution. This is, if you ask me, this would be the best approach, because if you have good leaders, the good leaders will bring money to the institution, will continue training people for the institution, will continue to implement the mission of the institution, but not technically only, but to tie the technical expertise also with the soft skills, because it's very important. Communication, how to manage teams, how to, for example, foster talents in the group, so that the groups can grow and the institution also can grow.
All right, thank you very much, Niels. I think that's quite clear, and I think we know what to do for the coming years together. In case there are no further questions, I want to thank you, Nilsa, for this very clear and interesting presentation. I want to thank everybody who was present here. As I said at the beginning of the webinar, we will share the recording, both for ITM staff on our internal knowledge sharing platform, and for others outside of ITM through our YouTube channel. So in case you still have any questions, please feel free to reach out to me. You will find my name in the invitation you received. Nilsa, I will ask you as well to share your presentation if that is possible. And then for those interested, they can also receive that presentation. I see.
Can I say
one
last word?
Yes.
Sorry.
Please.
I would like to thank you for the invitation. I would like also to thank you for this collaboration, to ITM. We have been talking every month, and sometimes more than once a month. So this is very important to us for the institution, and not only as an institution, but because ITM understood the needs of INS. ITM has been collaborating in a different manner, as asking INS, how can we help? So this is very wisdom, because we say, okay, we need this, can you help us? And can you teach us how to do this? And I think that this collaboration is very powerful in this sense. There is no word to thank you to all the institution for that, and to say thank you, it's not enough. I will say in my words here is saying kanimambo.
And then we close off with a new word that we've just learned. Maybe also a little word of thanks to Sander, who's also raising his hand, by the way, for the very flexible funding that we receive from Flanders to implement this project. Sander, I saw you raised your hand. Did you still want to say something?
No, I just wanted to thank the presenters. It was very interesting,
right.
and hope to see you in the near future.
All right. Thank you very much, everybody, and have a lovely rest of the day.
Bye. Stay well.